Okay, this is a medical. You're dispatched to a medical incident where a 33-year-old male is reportedly unconscious in a vehicle. It's the parking lot of a store, whatever store you want to envision, but a concerned citizen called 911 and reported this. Law enforcement gets on scene before you knock on the window. The guy doesn't respond. They open the door, confirm he's unconscious, but they don't give you any other information. So you are responding again with an ambulance, another EMT on your ambulance, and then you have a fire truck with 3 other people. So tell me what you do in this scenario.
Okay, so he's already out of the vehicle.
We'll say, yeah. Let's say they pulled him out. He's lying on the ground when you get there.
Okay, so first thing is obviously PPE. He's unconscious, so I'm going to bring my medical mask and my eye protection. First thing I'm going to do when I get out is to make sure the scene's safe.
It is safe. And your scene survey, you see this vehicle. It's a 4-door sedan. There's no apparent damage to it. It's older. Looks a little rough shape. So yeah, go ahead with your assessment.
Okay. So the scene's safe. The nothing like that. He's unconscious. So I'm leaning more towards NOI. It's just him. Is there anybody else around him? Okay. So
nope.
I'm going to go ahead and call. Because he's unconscious. I'm going to go ahead and call for ALS.
Okay.
Then I'm gonna consider spine stabilization. Since it doesn't seem like anything's going on, I'm not going to bring it. So my general impression of the patient is going to be poor because he's unconscious.
Okay.
First thing I'm going to do up to him is I'm going to check his alertness. Hey, sir, can you hear me? My name is Andrew with the fire department. I'm going to squeeze his trap, see if he's awake and response.
He does not respond to your voice, nor when you cause him pain on his traps. No response.
Okay. Is he breathing?
He is breathing very shallow at 4 breaths per minute.
Okay. And I'm going to check his pulse.
His pulse is rapid at 100 beats per minute.
Okay. Since he's unconscious, I mean, the first thing I'm going to do is I'm going to secure his airway.
Okay.
So
how would you do that?
So the first thing I'm going to do is I'm going to do a head tilt chin lift. I'm going to go ahead and open that up. I'm going to visually inspect, make sure there's nothing in there. And then I'm going to go ahead and clear the airway if there was anything in there. So we can just skip right past that. I'm going to secure it.
Clear.
Okay, so I'm going to secure it. I'm going to attempt to do an OPA. Is there gas? Okay, so he accepts it. There's no gag reflex. And then I'm going to start ventilating him because he's got low respiration. So I'm going to start with ventilation with O2, 25 liters. And then I'm going to go ahead and one breath every 5 to 6 seconds.
I want you to clarify how much oxygen you're going to give using the BVM.
I'm going to give him high flow oxygen. So I'm going to say 15 to 20.
Okay.
We'll start lower.
What's the measurement
for
oxygen administration? Meaning, is it PSI? Is it millimeters, milligrams, liters per minute?
It's liters per minute.
Yeah, good. Thank you.
Yeah, sorry. So then I'm gonna go ahead and ventilate him. And I'm gonna ask one of the guys to grab an AED, or one of the guys around me to grab an AED. We're gonna throw it on him. It's not gonna be necessary, but I'm gonna put it on him just to see if he's not tachycardic. Tachycardic. Which he shouldn't be, but just to keep his monitor his heart rate.
Okay, so let me clarify this for you. When you put an AED on, a straight up AED is not going to tell you anything other than whether shock is advised or not advised. Mm-hmm. And so you've already checked for a pulse via radio pulse, and it's 100. So an AED isn't going to help you out much.
Okay. So
a cardiac monitor, that's different.
That's I think what I was thinking. All right, so I'm gonna go ahead and I'm gonna put him in the ambulance and start transportation. And my I can't get history. So, but I'm when I move into the ambulance, I'm gonna grab his vitals. So one thing I definitely miss in my vitals is pulse ox.
Okay. Pulse ox comes back at you're giving him oxygen now, and it is now up to 84%. It was lower.
And then I'm gonna check his blood glucose.
Good. Blood glucose comes back at 88 milligrams per deciliter.
Okay, yeah, and this is going to be, since he's unconscious, I'm going to rapid transport, so that's going to be lights and sirens.
Okay.
And then from there, I can't get any history. So I'm going to check, see if he's got any medication on him or anything like that, to see if anything caused him to pass out.
Yeah. At this point, you're checking for medication. You're also kind of doing a little size up. You see he has some track marks on his arm, and he's got a tourniquet still on his arm.
Okay. Well, then I'm gonna double check, but I'm gonna go through and check his eyes, see if they're dilated.
They are not dilated. They're a pinpoint.
All right. So first thing I'm thinking is OD. I'm gonna go ahead and give him Narcan, which is going to be 2 milligrams of Narcan in the nose for half the dose, and one nostril, half the dose in the other, and see how this affects him.
Okay. So you give Narcan. About 3 minutes later, let's say you're on your transport, you have 10 minutes to the hospital. You give Narcan. 3 minutes later, he starts blinking his eyes and moaning and kind of slowly starting to like move his hand up against the BVM. Like, I don't like this.
Okay. I'm gonna raise, hey sir, can you hear me? Can you understand what I'm saying?
And he's like, where am I? What's going on?
Okay. Let's see. So I'm gonna hit, since I only gave him one dose, he started to wake up. I'm gonna hit him with another dosage of Narcan.
Okay.
Since the 3 minutes time, the next time has to pass, so I'm gonna hit him with another dose of Narcan and see how that makes him feel better.
Okay. Give him the Narcan. 3 minutes later, he's awake, looking around. He's breathing better. He keeps hitting that BVM, so your partner stops doing that, and he's awake.
Okay, so
what's
he's breathing.
Going on? What are you guys doing to me?
Hey, sir. Hey, you were unconscious. We found you in your car. Can you tell me what's going on and what happened?
I was just I was at the store. I was getting some groceries. That's all.
Okay. Well, we found you unconscious. Someone called. You were unconscious. We started transporting you. We're on the way to the hospital at the moment. We already gave you 2 doses of Narcan to wake you up. And then from there, I'm going to go back after I explain that to him and let him know, see how he reacts, make sure he doesn't obviously see if he wants to be there or not. And then since he's awake now, and since we still have time, I'm going to go back and try and get my history. Now that he's awake.
Okay. So tell me what type of history you want, and then I will give it to you.
So I'm looking for, definitely, if I can get him to tell me what kind of medication he was taking. We know that he was having an OD, and he still had track marks and tourniquet still tied to him.
He says, "No, I don't take any medications. I didn't overdose on anything. I don't do that stuff."
Okay, all right. I'm going to check and. That's fine. I'm going to shake my head and agree with them. Okay, sir, that's fine. Well, we're on our way to the hospital. Are you having any pain? Are you hurting anywhere else?
No, I don't even know why you guys are taking me to the hospital. I don't understand.
Okay. Well, like I said, we found you unconscious. So that's the reason being. Other than that, I really can't do much more for this guy, other than recheck his vitals, go through another secondary assessment if he'll let me.
Okay. So you're going to do the vitals again. What vital signs do you want? And I'll give them to you.
BP, pulse, or blood pressure, pulse, respiratory rate, and O2 sat.
Okay. Blood pressure comes back at 126 over 80. Pulse is 76, and regular respiratory rate is 18 breaths per minute, non-labored. O2 saturation is 97%.
Okay. So my general field impression, he was definitely overdosed with something. Wouldn't give him the proper information in order to figure out what it was. We gave him 2 doses of Narcan. He's now alert and verbal. And then I'm just going to go ahead and I'm going to reassess him every 15 minutes. Since it's not going to take that long, I'm going to bring it down to 5 until the rest of the ride of the hospital.
Okay.
And my my report would just be he's a 33-year-old male. He was found unconscious and with low respirations. He's got no physical injuries. Signs and symptoms were that of an overdose. He had a breathing rate of 4. His pulse was rapid, and 100 beats per minute. His O2 was 8, 9 when we found him. Treatments, like I said, we gave him 2 doses of Narcan, and any significant injury is BP is now 126 over 80. Pulse was 76. Respirations are 18 and not labored. And O2 sat is 97%.
Okay. And stop. Okay. How'd it feel? How'd that go?
I felt a lot more smooth. I felt knowing, kind of understood. As soon as I figured out it was an overdose, I knew the path that I needed to take.
Okay. You completed that in a quarter of the time of your trauma, but that's okay. This was I wouldn't say bread and butter. There's some investigation that needs to take place with this call. Had you transported without even considering Narcan or going down the drug route, I would have been disappointed. But you did. You got it. And you also checked out blood sugar early to rule out hypoglycemia.
Mm-hmm.
You did, right?
Yeah, I did.
Yes, you did.
You said it was. Okay. You said it was.
88.
Where's it? 88.
Yep. Okay. So, yeah. So this is not uncommon. People will go find a hole in the parking lot and get high, and if it's the wrong amount or the wrong drug, they will go unconscious and they will slowly stop breathing to the point of unconsciousness, respiratory distress, cardiac arrest. And then so with this one, I probably would have done Narcan sooner just because of circumstances. Now, because if this is a scenario, you didn't have the ability to look in the car really quick. Is there any drug paraphernalia? But that would be something on your scene size upper 360 that would indicate this. Okay. But as we've mentioned earlier, this could be a drug overdose. This could be a diabetic. This could be the seizure patient. This could be the cardiac arrest or near arrest that is occurring. And so it's not typical for a 33-year-old to go in a cardiac arrest sitting in a vehicle in a parking lot. But nonetheless, you got to just do your assessment. Find those things that you know you can fix. Monitor their airway. If they're not breathing appropriately, bag them. Perfect. So I thought this was a really good assessment. You threw the AED in there, which threw a loop in there. But let me clarify. In the real world, in an ALS agency, you do have a cardiac monitor at your disposal. And what that cardiac monitor will provide is an automated blood pressure. You have a pulse oximeter. You're going to put that on early. While you're doing your assessment, maybe checking for the drug overdose, checking a blood sugar, etc. Somebody else is going to grab those vital signs. Hey, let's get a quick 4 lead on this guy, and so we can monitor that pulse. That is kind of where I think your head was going, and that's okay. And so we're monitoring that, and we're not putting that on to shock him per se right now. But this guy's sick, and as an EMT, you might be thinking about this person going into cardiac arrest. You don't know what's going on.
Mhm.
So let me ask you, good job, you passed. Let me ask you the scenario where, what if this guy did not respond to the Narcan? What would you have done, if anything?
Do I still know that he's still got those track marks and the tourniquet on? I
Mm-hmm.
would have hit him again.
Okay. And no response.
No response. Then, um,
How do you
then it could
determine
possibly.
whether this is a opiate overdose versus something else?
Mm, well, we checked his pupils, so we
Okay.
know it's definitely an overdose of some sort of medication.
Okay.
Um, I guess if it was if we found like, oh yeah, he's got a bottle, a prescription, to that, then that would be something to indicate whether it was not an overdose on his
Okay.
prescription meds or not. I honestly, I don't know exactly what I would do if it was if he didn't keep responding. I would keep giving him the Narcan. I mean, the only thing I can really do for him is to try and pull him out of this level
Okay.
altered, this unconsciousness.
So just a reminder, Narcan only works for opiate overdoses. So if
Mhm.
he's overdosed on multiple things, including other stimulants, cocaine, uh, LSD, ecstasy, something that might make those pupils a little bit larger, or maybe he took a bottle of his prescription medication and he's just done with life and wants to be done. Narcan's not going to touch it. They're going to
Yeah.
maintain that level of unconsciousness,
Mhm.
and you're going to monitor airway, breathing, circulation, and then
Just
provide rapid transport. Get a medic coming. A medic is probably going to opt to intubate this patient, and then it all depends on how close to the hospital and such you are, but sometimes you just can't
pull them out.
help these patients. Now let me throw this at you as well. The unconscious patient, while this is a medical incident, also earns a full body assessment. Was this guy shot? Was this guy beat up? Does he have any trauma anywhere? Anything that you can treat or at least find, penetrating trauma, whatever. So just make sure you do a good assessment with that as well.